Today I am going to speak about hair loss. There are many kinds of hair loss. Among the many types, telogen effluvium is the commonest one seen, and it is more common in women. So what is telogen effluvium? It is a temporary thinning of hair on the scalp because of changes in the growth cycle of the hair, so which leads to increased shedding of the telogen hair in the growth cycle. So it can be acute or chronic. Acute where there is history of hair loss around 3 months, and chronic where there is history more than 3 months. So what are the causes of acute telogen effluvium? See, it might be seen in the people who have suffered fevers for a long time, like typhoid, malaria, dengue, or after a childbirth, after delivery, or after a accidental trauma, after a long emotional distress, or after a major surgical operations where there is severe hemorrhage, and the people who are using medications like oral contraceptives or hormonal replacement treatment, etc.
There are many causes of hair loss, but by far the most common in men and women is genetic or patterned hair loss. Male pattern hair loss in men is extremely common in the United States. It affects over 50 million men and over 35 million women. There are other causes of hair loss as well, they're just not quite as common. There's a telogen effluvium, which is actually just a shedding of hair, and that often can happen with periods of stress. It can happen after general anesthesia, it can happen with a traumatic event, it can happen after crash dieting as well. There's other medical conditions that can cause hair loss, such as thyroid disease and anemia. And there's something called alopecia areata, where people lose generally little patches of baldness. And that's an autoimmune process that affects about 2% of the population. But again, to reiterate, the most common form of hair loss is genetic, it's inherited, it's male and female pattern hair loss.
In today's video, we are going to talk about diseases that cause hair loss. Hair loss is an issue that really affects a lot of people today, and there are several conditions that could lead to hair loss. One being hypothyroid. You've probably heard that term before, but it's basically when your thyroid function is lower than normal. And you can speak more with your doctor about how to treat that. Another condition is alopecia, and this is more of an immune-related response to hair loss. Nutrient deficiencies are also key components of hair loss. If you don't have the nutrients and building blocks you need to grow hair, it won't happen. And stress is another really big and often overlooked cause of hair loss. Stress could be physical stress, where you're physically having an illness or infection or something going on, or it can be more of a mental stress, which is more related to your thinking or mindset, or there could be a lot of reasons with stress. I'm Dr. Stacey Mobley, and I blend the best of mainstream and natural therapies to help you transform your health, re-energize your life, and renew your mind.
Hair loss may refer to gradual thinning of hair, reclining hairline, or bald patches. Androgenic alopecia is the most rigid form of hair loss. It happens when testosterone in both males and females gets converted to DHT. DHT contracts hair follicles, making them smaller and incapable of growing hair. Other major causes of hair loss are chronic stress and trauma, malnutrition, and hormonal imbalance. Hair loss due to these causes can be managed and prevented by dealing with underlying conditions. Here are a few home remedies that will help you create a premise for healthy hair and initiate hair growth. Take 1 crushed onion, strain the juice from it, add 3 drops of rose water, mix this well, apply this juice on your scalp, leave it as it is for about an hour. Wash it well with lukewarm water and a mild shampoo. Use this twice a week. Onion works as a hair stimulant that promotes new hair growth. It increases blood circulation and is also an antiseptic that keeps the scalp clean. Take 1 cup of fresh coriander leaves and put it in a blender. Add a little water. Blend this together. Strain the juice. Apply this juice on your scalp, leave it as it is for an hour, wash it well with lukewarm water using a mild shampoo. Coriander leaves are a rich source of vitamin A, vitamin B6 and iron. All of these play a vital role in promoting hair growth. It also contains protein, which is crucial for hair nourishment. Remember to combine these remedies with a healthy, balanced diet, as there can be no better cure to hair loss than proper nourishment. Take care.
Welcome to Superscene Dermatology Group. Today we're going to be drawing blood for a PRP treatment for hair loss. We're going to use the vein finder so we can find the blood on the first try. Here you can see the vein. We're going to mark the vein so that we don't lose it. And then we're going to go ahead and draw the blood.
Now we're going to start the actual procedure. And we take the blood and we spin it out, and then we are able to separate it into a syringe so that we have the platelet-rich plasma that we can inject directly into his scalp. For comfort and convenience, we have the Zimmer chiller, which we are going to be blowing directly on his scalp so that he feels it in a very minimal way. And we're going to do small little pinches. So we're going to start here. We're going to blow the air. And 1, 2, 3, pinch. And how did that feel?
Fine.
Not too bad?
Nope.
We're going to do another one right here. Okay, so with the air blowing on the patient, they don't feel the pinch at all. Perfect. And then after the injections, we give a little massage. And that's the end of the treatment.